Hello everyone, welcome back to this short tutorial from iLovePharmacology. Let's learn about the human recombinant insulin today. So the action of insulin, as you know, insulin is required for the uptake of glucose into the muscles as well as the tissue. So if there is an insulin deficiency or if there is a irregularity in the insulin release from the beta cells of the pancreas, what will happen is we develop a condition called as diabetes mellitus. So if it is from the birth, it is called as type 1 diabetes mellitus, where there will be complete inefficiency of pancreas to produce the insulin. So due to some genetic factor as well as the age, if they develop the insulin irregularity in the middle of the ages, like in the 40s, so then it would be type 2 diabetes mellitus, where there will be release of insulin but there won't be a sufficient release of insulin to tackle the amount of glucose present in the body. So basically the insulin which you give from externally, which is a human recombinant insulin, is helpful in promoting the tissue uptake and storage of glucose as well as amino acids and the fats. Along with that, it also inhibits the hepatic glycogenolysis and gluconeogenesis, thereby it decreases the glucose levels. Along with that, it also increases the glycogen synthesis in the muscle as well as in the liver. It also inhibits the lipolysis. So basically all these things will help in reducing the blood sugar levels. And also it acts as a building block where it stimulates the protein synthesis, and in the long run it affects the growth and gene expression. So ultimately what will happen through these actions, it will acutely lower the blood sugar levels in the body. So let us understand the mechanism of action of insulin. So basically the insulin will bind to the insulin receptor, or they are also called as tyrosine kinase type receptor, which is present on the cells of the muscular tissue, where it undergoes autophosphorylation. The receptor, that is the tyrosine kinase receptor, undergoes autophosphorylation. Thereby there is a tyrosine phosphorylation of insulin receptor substrate, which then activates the SH2 domain protein, which is responsible for regulating the various intracellular enzymes as well as cell membrane glucose transporter. That means to say, whenever you activate the insulin receptors, it will going to activate the glucose receptor which is present on the cells. Thereby there will be intake of the glucose. That means insulin will help in uptake of the glucose into the cells. So coming to the pharmacokinetic parameter, the free insulin in the body has got half-life of only 10 minutes, which is very short, and because of that the slow release preparations are needed for regular use, so that they will produce its action for over a period of time. So commonly the insulin is injected through subcutaneous route, but in case of emergency situations like the diabetes ketoacidosis, you need to give it through IV route because it is an emergency condition. So where can we use this insulin? So before going to that, let us understand the types of insulin. So we have a short acting insulin which will act for 3 to 5 hours. We have a regular, or it's also called as soluble insulin, and we have a insulin lespro, insulin aspart, and we have an intermediate acting insulin which acts for 10 to 12 hours. We have isophene insulin, and we have a long acting insulin preparations which acts for 24 hours or beyond 24 hours. We have an insulin zinc suspension which is also called as crystalline insulin, and we have an insulin glargine and insulin detemer. So basically the insulin is useful or a drug of choice for type 1 diabetes mellitus. It is a lifelong treatment that has to be taken by a type 1 diabetes through subcutaneous route. So when do we require insulin in type 2 diabetes mellitus? Whenever the diabetes or blood sugar levels are not controlled by the oral hypoglycemic agents. So one more very important thing is the regular or soluble insulin is a drug of choice which has to be injected through IV route in the treatment of emergency condition that is called as diabetic ketoacidosis. So when we see the adverse effect profile, the insulin, since it increases the uptake of glucose into the tissues, what happens to the blood sugar levels? The blood sugar levels will drop. So they are more prone for hypoglycemic risk. So glucose has to be administered by mouth if he is conscious. Otherwise, it has to be given through IV route, or glucagon has to be given through IM or IV or subcutaneous or through intranasal route. Apart from that, since it helps in the glucose accumulation, so the person may become fat. So there can be a weight gain, mainly in case of type 2 diabetes mellitus patients. So this was about the brief pharmacology of the insulin and insulin preparations, how they are acting, what is the mechanism of action, where they are used, and what is the adverse effect profile, as well as what are the insulin analogs. Thank you.